Hi, my name is Susan Sullivan and I'm a registered nurse. I'm the Director of Operations here at the Williams Plastic Surgery Specialists. And I'm so excited to share information with all of our girlfriends out there. Today I'd like to speak a little bit on replacing volume in the face. And it really is a very upcoming thing that we do now. We do it in a number of different ways. One way, and the most natural way, is by replacing volume with fat. Your own fat, where Dr. Williams makes a small tiny incision somewhere in the vicinity of the belly button and takes a little bit of fat out. And he places it deep within the muscle and follows your natural bony structure and the contour of your face and lays down little tiny droplets. Sometimes patients can have volume replacement done with products such as Restylane, Juvederm, Radius, but really what we see now is the replacement for volume with fat is so natural looking. There's a new product also coming out soon that will be FDA approved, and it's called Sculptra. We do that for patients that require really little to no downtime, yet the results with Sculptra take a number of months to see. The thing with fat that's so great is you see immediate results, and it lasts for a number of years. A lot of patients really opt to have volume replacement done with fat because it is more natural and it is your own. So we're very lucky today to have with us a patient who's had volume replacement in the mid-face and in the lower eyelids. And she had this done about a month ago.
December 23rd.
And so if you can tell me where we brought you and you had this procedure done in the operating room?
Downstairs.
In our facility?
Yes.
And you had a little bit of Novocaine and...
Well, okay, actually they took the fat out of my abdomen with Novocaine, painless. And then they also injected my face with the Novocaine, and then Dr. Williams injected my fat from my abdomen to my face.
And so tell me, when you left here, were you able to drive home or...?
I very well could have, but it was advised I brought a friend to drive me home because I did have a sedative prior.
So you took a pill before, a little bit of oral sedation that helped you relax
Right.
a little bit. And it made the procedure tolerable.
It was absolutely tolerable. It was painless. Like I said, I could have driven home.
Great. So what really made you come to see Dr. Williams?
Well, I'm 50, and of course, you know, with the natural aging process going on, but I also had circles under my eyes my whole life, which were genetic. So since I was a teenager, I was always being asked, you know, are you tired? Because I had these circles under my eyes. This is the first time in my life I don't have them, and I haven't had anybody ask me if I'm tired since I had the procedure.
So in the past, the people would always look at you and say, "What, are you tired today?"
Yeah, I would apparently I always looked tired, which I would see it too when I looked in the mirror.
Yeah.
So he put the fat in my cheeks, which of course lifted the circles, so now I don't have them.
Great. And so tell me, how is it now that you feel when you look in the mirror and you don't see those circles anymore?
It's just so much more pleasant to look at my face. And of course with the volume, it took away some of the wrinkles, so it had a couple of different results.
So for everyone out there who's watching today, what do you have to say? Is it something that you would recommend? Or is
Oh, definitely. And you know, I wish I had had this done years ago, even, you know, as a teenager, because if not for the wrinkles, but for those circles, the genetic circles I had.
Well, I thank you very much for sharing this with our friends out there. And if you'd like to make an appointment with Dr. Williams, he is a face specialist, and he is known for his level of knowledge in the face. And he really is at the forefront of replacing volume. So you can contact us at Williams Facial Plastic Surgery Specialists, and I hope you enjoyed this.